Hey guys, this is Thomas Wells, founder and CEO of The Body Mechanic, and I wanted to demonstrate for you today a mobilization for the thoracic spine, specifically opening you up into extension. So this helps counter the rounding a lot of us develop in our back, known as kyphosis. So there's a lot of different stretches and exercises out there for dealing with this. This one I'm going to show you is one I give to a lot of my clients to do at home because I find it's really direct and really gets in there and really helps mobilize some of the segments that are really stuck, and it tends to allow a lot of the other stretches and the other techniques out there to work better by first doing this. So to do this, you are going to want a foam roller of some kind. This is actually a foam roller, albeit hollow, but mainly for its size and shape more than anything else. And we're not really going to be doing traditional foam rolling techniques on it, but more just kind of using it as a lever. So this is what it's going to look like here. You're going to have this thing perpendicular to your spine, so you want it kind of width-wise on your body here. And you're going to lay down, as my change falls out, you're going to lay down over the thing. So you want your feet on the ground, knees bent, and you can keep your butt on the ground too, because we're not going to roll the low back. We're only getting from about T12 up to the upper thoracic there. Can't really roll out the upper few segments there. So about 8 or 9 segments we're going to be able to get here. So you're going to lay back over it, and I want you to support the head like so. And the basic motion is you're going to be arching back over the roller. A couple things to be mindful of when you do this. First, you want to lengthen the spine. So you want to kind of elongate yourself like so before you arch back. The reason being that the facet joints in the spine, which are the spines where each vertebra meets the adjacent vertebra, they tend to get sort of jammed together in extension. But if you traction, that helps alleviate a lot of that compression of the joint. So sort of elongate, kind of lengthening through the top of the head, then you're going to arch back. The other thing I want you to do is when supporting the head, which you're definitely going to want to do because your neck will get tired holding your head up. When supporting the head, you're going to want to keep your arms out like so and not pull them in. Because when we pull the elbows in like this, not only does it draw the muscles of the thoracic spine pretty taut, which is going to limit your ability to extend, but there's also a tendency to get almost into a curl up or sit up position when we bring the elbows in. So we're going to want to keep that open like that. And then you're going to pick a spot that feels especially restricted or tight, and you're going to just let gravity do its thing. You're going to arch back over the roller until your body has picked up all the slack. Okay? It's not unusual to hear some sort of pops and cracks in your spine there as things move into place. That's usually going to be a good thing for you. Okay, so once you've picked up all the slack, now you're just going to breathe into it. So taking some nice diaphragmatic breaths. What you'll notice is after initially picking up the slack, you're going to feel yourself sink in a little bit more. Just a little bit more. And once you feel yourself sink in a little bit more, then you want to come out of it and roll to the next spot. You don't want to linger there too long, because if you stay too long always waiting for more and more relaxation, this can leave you pretty darn sore afterwards. So it's good to not get too greedy on this. So we just pick up all the slack. Okay, then we do our diaphragmatic breathing and wait for ourselves to sink in just that little bit extra. And it usually happens within 5 or 10 seconds of hitting our initial stopping point. And then you'll hit another stopping point, and that's when we make sure not to be greedy, move out of that spot, and again, find a new spot. And you can do this for as many spots as you need. Again, those first 4 thoracic vertebrae or so, you're going to have trouble using this on because you just don't really have enough weight on there. And the weight of the head doesn't really help you much in that position. You can certainly do it, you just might get minimal results out of it, but that, about T4 to T12, that'll work really well. So again, don't linger too long. I would start off with maybe 5 or 6 spots and just kind of see how you respond. It's not unusual to get a little sore from this the first time you do it. maybe even the first 2 times you do it, but it won't last forever. Just by improving the extension like that, you might find that you also get better rotation. You might even get better flexion, like your forward bending might improve as well. But like I said, this is a good prelude to any other thoracic or T-spine mobilization or stretches you might do, just creating that sort of segmental mobility that a lot of us lack. And just doing things like press up motions or cobra positions, that's not going to get that deep release that this can get, particularly on what's called the anterior longitudinal ligament, which is a ligament on the front of the spine that limits our ability to extend. And ligaments can take a bit longer to relax than muscles do. So getting this really targeted stretch into that segment, then just breathing into it and waiting can be really useful. Sometimes it's going to take longer to get that relaxation than others. If you have like a contracture in the ligament or the fascia or something like that. But you just ride it out as long as you can or as long as you need to. As soon as you feel that second relaxation happen, you just move to a new spot. It doesn't matter whether you start at the top and work your way down or start at the bottom and work your way up. Just make sure you don't try to do the lumbar spine for this, the low back. A, this wouldn't be useful for that, but B, it would probably really irritate your back, so I don't suggest it. So give this a try. I think you'll find it useful. Certainly I have and my clients have, and I'll see you next time.